Good evening. Welcome back to Open Med School. In the last session, we have discussed about various types of focal epilepsy. Today, I'll be discussing about generalized epilepsy and generalized seizures. As mentioned earlier, epilepsy is a tendency to have recurrent seizures, and seizures are due to synchronous discharge of cortical neurons. And when it is occurring in widespread networks throughout both hemispheres, it is a generalized seizure. That is a fundamental difference between focal seizure and generalized seizure. You can see in this picture. Next, you should think about in generalized seizure, as both cortices are activated simultaneously, there is loss of consciousness. That is, suddenly the patient loses consciousness, followed by various other manifestations occur. So, the seizure types are various types. This include tonic type, clonic type, previously called the tonic-clonic was called the grand mal seizure, absent seizures, previously called the petit mal seizure, myoclonic jerks, okay, the jerky movements, myoclonic jerks, and atonic seizure, sudden loss of the postural tone. So these are the various types of seizures. Now we'll see how does a tonic-clonic seizure looks like. Here we can see the whole body goes into tonic-clonic movement. Tonic means there is a spasm, clonic means the jerky movement. It occurs bilaterally, so it is called generalized tonic-clonic seizure, otherwise called the grand mal seizure. This is in contrast to the absent seizure. Look at this child, he is doing something, he stops doing, now stares, few eye blinking, and resumes the work that he was doing. This is an example of absent seizure. In absent seizure, there is no loss of postural tone. As seen in this picture, in this video, the child will be doing something, she stops the work, stares at something. He may have one or few blinking of eyes. Then the child continued to do the activity. So this is the typical absent seizure. And in absent seizure, the electrical activity or the EEG shows 3 per second spike and wave discharges. That is a characteristic bilateral symmetrical 3 per second spike and wave discharges. That is a characteristic abnormality that you get in petit mal seizure. Myoclonic seizure include sudden brief muscle jerks or twitches. This usually affects the various groups of muscle or the entire body and can occur in clusters. Recurrent episodes can occur. It has got a tendency to occur in the early morning, and the classical disease is the juvenile myoclonic epilepsy, about which we will discuss later. Now we go to the atonic seizure. In atonic seizure is otherwise called the drop attacks. So here, look at the child, sudden drop in the tone producing what is called the drop attack. Hope these seizure manifestations are clear to you. Then there is tonic seizure alone, tonic alone. That is a spasm of the whole body occurs. That is a tonic seizure. So we have described the various manifestations of generalized seizure, the mechanism. And what are the etiologies of this generalized seizure? Many of them have got a genetic, and they are primary generalized one. or secondary to other medical conditions such as brain injury, infection, metabolic causes, tumor, etc. The diagnosis depends upon the clinical history, that is the various manifestations and investigations including imaging and EEG and sometimes other genetic tests. Treatment depends upon the seizure type, about which we'll discuss later. So in this video we have discussed the various clinical manifestations of generalized seizures and the types of seizures. Hope it was useful to you. Thank you.